One of the most common reasons that patients travel to see me is that they have heard somewhere, or maybe they have read online, that I try to avoid spinal fusions. And that is actually the case. Over the past decade or so, my practice has evolved to where I really try to limit spinal fusions if possible. I'm Dr. Kamal Woods. I am a board certified neurosurgeon and a minimally invasive spine surgeon. Well, let's talk firstly about spinal fusions. What exactly are they? So think of a spinal fusion as there are two adjacent vertebrae and there's a disc in between the two. And with the fusion surgery, that disc is removed and cleaned out, and that's where the pressure can be removed off of the spinal cord or the nerves. So once everything is all cleaned out, there's now a gap between these two bones, and the fusion involves putting a spacer inside that gap. It's sometimes called a cage, and that spacer or that cage, it's filled with bone, and eventually the body builds bone across and bridges those two bones together so that they essentially become one solid piece of bone. Now, that can be a very important goal, especially in cases where there's instability. We see that in the setting of, trauma, where there's a fracture or maybe torn ligaments. We can see that in the setting of tumor. In other cases, a fusion may be needed if there is deformity. If the neck or back is crooked, such as in scoliosis, and one is trying to correct and to straighten that spine, then it may be necessary to do a fusion. However, in many cases, actually, the majority of people that have just everyday neck and back issues, where the problem is degenerative arthritis, that day-to-day wear and tear, what I often think of as the mileage on the tires. If that's the problem, a fusion surgery is usually not necessary for a lot of these patients. So, especially in the neck, the technology has evolved quite a lot over the past decade to where there are really good artificial discs on the market that are made of metal typically. Sometimes there's metal as well as a polymer, and that device is able to maintain flexion, extension, bending, rotation. It's able to maintain the movement of the spine and preserve motion. And to me, that's really critical. Instead of fusing two bones together, if we can maintain movement, I think ultimately that is a very, very desirable goal. And oftentimes we can solve the problem just as effectively or more effectively and maintain that movement. So if you or someone that you know has been told that you should have a spinal fusion or that they should have a spinal fusion, I would strongly recommend getting another opinion. Now, the one thing about disc replacement surgery is that not as many spine surgeons may have extensive experience with that kind of surgery. Fusion surgery, I would say, is fairly commonplace, and most spine surgeons are comfortable doing fusions in the neck and back. However, disc replacement surgery is a little bit of its own, beast. The amount of experience of that surgeon, I think, can often have an impact on the outcome. So it's very important to find someone who has a passion for this kind of surgery, who has studied it over time, who has experience, and who can really make the right choices and decisions and technically execute that surgery in order to make it successful.